Your clinic is running late. You're covering a colleague who is unfortunately sick. You missed lunch. You had to admit 2 patients. Your computer has crashed yet again. Your next patient has been waiting for an hour. When you finally see him, he complains about the long wait and says, "I've waited an hour for this appointment. I thought you forgot me, doctor." This is the last thing you need today. How do you deal with difficult interactions with patients? If you're new to this channel, hi, my name is Dr. Erwin. I'm a GP registrar. My mission is to help doctors lead a happy and successful life. Every Thursday, I publish new video covering the subject of GP training, well-being, and high performance. As a doctor, you may deal with difficult patient encounters in your practice. 15% of patient-physician encounters are rated as difficult by physicians involved. Difficult patient encounters can be attributed to various factors. It is useful to understand these factors in order to deal with difficult clinical encounters. We can group these factors into patient, doctor, disease, and situation. Patient can be abrupt, defensive, demanding, disruptive, and manipulative. It is usually best to avoid getting drawn in a conflict because you can risk making things worse. You may see a patient with a mild sore throat who demands a prescription of antibiotics. Sometimes patients may have unrealistic expectations and be demanding. Acknowledge the elephant in the room is an effective strategy to address the problem. It is important to acknowledge the patient's demand because it shows you have listened and understand them. While it is easier said than done, empathize with the patient and seek to understand their agenda. The reason for the demand could be due to anxiety, searching on Dr. Google, or ignorance. If you educate the patient about sore throat being mostly due to viral cause and the adverse effect of antibiotic, the latter might understand why you don't think antibiotic is in the best interest. An effective strategy is to propose an alternative option to the patient that will help them. You may recommend the patient to use over-the-counter medication to relieve their sore throat. See whether you can find a common ground with your patient and let them know that you're on the same team. Both of you want for the patient to get better. The patient may well be satisfied by your solution even if you don't prescribe the antibiotic. The attitudes and behaviors of doctors may contribute to difficult patient interactions. Doctors are humans. Their emotions and perceptions impact upon the care they provide. In the scenario of our doctor running late, can you think of any factors that may cause challenging patient encounters? There are many factors in this scenario. He missed his lunch break and is plowing through despite being hungry and fatigued. Doctors are notorious for working hard to the detriment of their health. Overcommitment is a common phenomenon among high-achieving professionals. This causes chronic stress and leads to frustration and burnout. Doctors in difficulty are likely to react negatively to patients. If you find yourself becoming tense or irritable, pause for a moment and take a deep breath. Make sure you look after yourself. Consider taking a break, even if it's just for a cup of tea. Clinical encounters can be more difficult due to the nature of a condition. These include a new diagnosis of a life-changing condition, managing chronic pain, or a condition with poor outlook. Breaking bad news to a patient can be challenging. It is important to plan your consultation, particularly if you need to give information that will be difficult for a patient to hear. If you want to learn how to break bad news, I covered a step-by-step framework known as SPIKES you can use to deliver bad news to patients. SPIKES stand for setting, perception, invitation, knowledge, empathy and emotion, and lastly, strategy and summarizing. So SPIKES is something that was created by Bales, and you can read about it if you'd like. So as a doctor, there will be times when you have to convey difficult and bad news to a patient. And it's never easy to hear bad news, but the way you deliver it to the patient will help for the patient to feel respected, cared for, and supported. So there are steps that you can follow to deliver bad news well. Last but not least is a situation. Circumstances surrounding the encounter may contribute to challenging patient interactions. These could be issues with your computer, being stretched due to limited resources, and the enormous pressure of work. Can you think of how our doctor dealt with his patient who waited 1 hour to be seen? He nearly snapped. Fortunately, he stayed calm, took a deep breath in, and smiled to the patient. He thanked the patient for his patience and apologized for any inconveniences caused. He proposed to the patient he would ask the receptionist in the future to inform patients they may have to wait or to reschedule appointment should they wish. The patient accepted the apology and said, "That's okay, doctor, I know you're busy." If the doctor didn't keep his cool and started to argue with the patient, this encounter would have escalated. Dealing with difficult patient encounters can be emotionally depleting. A useful strategy is to debrief the consultation with a supportive colleague. Having a pair of ears listening to your challenging encounters may help. Let me know down in the comment section how you manage difficult patient encounters. I read every comment that's posted in this channel. I hope you found this video useful to deal with challenging encounters. If you've not already subscribed to this channel, make sure you subscribe and hit the bell so you don't miss any future videos. Don't forget to smash the like button if you enjoy this video.